Question. Let's zoom into the wheel pattern foveal appearance as characteristic of 1. X-linked juvenile retinoschisis. 2. Vitelliform macular dystrophy. 3. Stellate maculopathy and neuroretinitis. 4. Central serous chorioretinopathy. Eyes tell stories, pick the pattern that fits best. Party popper, welcome to our live trivia show, where sharp minds meet sharper vision, Ophthalmology edition. Hi. Get ready to test your knowledge on everything from retinal diseases to pediatric eye conditions and beyond. We've got 9 brain-teasing questions, each with 4 options, only one is the correct answer. The faster you answer, the more points you score, speed and accuracy both matter here. To play, just comment the number of the correct option or type the full answer, easy. From Sherrington's Law to trabeculectomy, this quiz will challenge your clinical eye expertise. Think you can spot the right diagnosis faster than anyone else? Let's find out right now. Brush up on your ocular motility, biometry, and neuro-ophthalmology. It's all fair game today. Remember, 9 questions, 4 options, 1 correct answer, comment number or full answer to play. White heavy check mark. Here comes question 1 of 9. Let's sharpen those diagnostic skills together. Spoke wheel pattern foveal appearance is characteristic of which of the following conditions? 1. X-linked juvenile retinoschisis. 2. Vitelliform macular dystrophy. 3. Stellate maculopathy and neuroretinitis. 4. Central serous chorioretinopathy. Comment the number or type the full answer. Speed gives you more points. The spoke wheel foveal pattern often reflects structural retinal layer splitting. Fascinating, right? Correct answer, X-linked juvenile retinoschisis. Well done. 25 of 29 players got it right. Shout out, Mr. Native, Ahmed, Bahi. Alright, question 2 of 9, let's test your post-op glaucoma knowledge. 3 days post-trabeculectomy, shallow chamber, IOP5, flat bleb, negative Seidel. What's the diagnosis? 1. Ciliary body shutdown. 2. Bleb leak. 3. Aqueous misdirection. 4. Overfiltration. Think carefully, timing and detail matter in post-surgical cases. Ciliary body can temporarily stop producing aqueous humor post-surgery. Correct answer, ciliary body shutdown, great clinical thinking. 12 of 36 players answered it correctly. Bravo Fawzia, Bahi, Amira, Mohammed, sharp minds. Question 3 coming in, ready for a refractive mystery? Let's go. High myope, -14 DOD, axial length 23.8 mm, K's look normal. What's the most likely diagnosis? 1. Posterior lentiginous. 2. Keratoconus. 3. Index myopia. 4. Axial myopia. Think carefully, biometry often reveals more than meets the eye. Posterior lentiginous can mimic high myopia despite normal axial length. Correct answer, posterior lentiginous, well spotted, ophthalmic sleuths. 10 of 34 players answered it correctly. Ahmad, Mariam, Hamida, Maha, brilliant diagnostic instincts there. Time for question 4. Ready for a metabolic mystery challenge? Which systemic disease links retinitis pigmentosa and phytanic acid metabolism dysfunction? 1. Von Gierk's disease. 2. Tangier disease. 3. Refsum's disease. 4. Basson-Cornsweg disease. Eyes and metabolism, more connected than you'd think. Lock in your answers. Phytanic acid accumulates in tissues when its metabolism is impaired. Rare but impactful. Correct answer, Refsum's disease. Well done, medical detectives. 31 of 37 players nailed it brilliantly. Shout out to Bahi, Ahmad, Shima, and Mr. Native. Question 5 coming in, optic nerves under the spotlight now. In pseudo-Foster-Kennedy syndrome, optic atrophy usually results from 1. Retinal vein occlusion. 2. Glaucomatous optic neuropathy. 3. Direct tumor compression. 4. Chronic papilledema that has subsided. Think carefully, optic clues can be tricky. Lock in your answers. Foster-Kennedy syndrome involves optic atrophy and contralateral papilledema, rare but fascinating. Correct answer, chronic papilledema that has subsided. Only 8 of 36 answered correctly, tough one. Congrats Ahmad, Mariam, Amani, and Ihab. Question 6. Let's zoom in on a classic optic clue. Double ring sign is classically seen in 1. Optic nerve hypoplasia. 2. Optic disc pit. 3. Optic disc drusen. 4. Morning glory syndrome. Eyes wide open, lock in those answers now. The double ring sign hints at underdeveloped optic nerve tissue, pretty intriguing. Correct answer, optic nerve hypoplasia. Well done. 28 of 37 players answered correctly, great job. Shout out to Dodi, Mr. Native, Bahi. Question 7. Time to focus on pediatric vision care. What is the optimum time to operate on a patient with bilateral dense congenital cataracts? 1. Between 6 months and 1 year of age. 2. Between 2 months and 6 months of age. 3. Between 1 and 2 years of age. 4. ASAP, even within the first few weeks of life. Tick-tock. Choose wisely, timing really matters in early eye development. Early cataract surgery helps prevent irreversible vision loss in infants. Timing is everything. Correct answer, operate ASAP, within first weeks. 20 of 37 players answered this correctly. Bravo Mahmood, Ahmad, Bahi, Mohammed, great job. Question 8. Let's flex those extraocular muscle facts. Action of superior rectus in adduction is 1. Intorsion. 2. Extorsion. 3. Elevation. 4. Depression. Eyes on the prize, pick your answer carefully, Vision Pros. Superior rectus helps intort the eye when it's adducted. Cool, right? Correct answer, intorsion, superior rectus gets twisty. 18 of 39 players nailed it. Shout out Mahmood, Bahi, Ahmed, Nadia, well done. Final question, let's finish strong, eye movement masters. Which one of the following best illustrates an exception to Sherrington's law? 1. Dissociated vertical deviation. 2. Convergence. 3. Alternating esotropia. 4. Duane's type I. Think carefully, Sherrington's law has one surprising exception. Sherrington's law explains reciprocal innervation. When one muscle contracts, its antagonist relaxes. Correct answer, Duane's type I, tricky but learnable. 15 of 37 players answered correctly. Bravo Dr. Hassan, Amani, Sarah, Maha. Big congratulations to our top scorer with 7 correct answers. Well done Dr. Shima, Mahmood, Maha, Mohammed, and Bahi. 41 players joined, amazing energy, everyone. Thanks for playing, see you next trivia night.